Hello, I'm Dr. Saravanan. I'm a senior interventional cardiologist and cardiac electrophysiologist. I currently practice in Bangalore. I qualified from Madurai Medical College doing my MBBS and MD internal medicine from there, and then I went to the UK where I did all my training in cardiology. I then worked as a senior cardiologist in northwest of England before coming back to India in 2017. I've been working in Chennai and now I work in Bangalore, in East Bangalore, in a large medical college hospital as a medical director and HOD of cardiology and interventional cardiologist along with electrophysiology. I deal with patients on a daily basis who have various heart problems, and they come to me initially for an assessment and treatment. When they do that, the initial assessment will show what type of heart problem they may have. And most of the time, they will have conditions which I can easily treat by non-invasive or non-open surgeries. Without doing any surgery, I will do a microsurgery where I will go at the wrist or in the leg, in the arteries in the leg and the veins in the leg or the arteries in the hand, and then do various procedures. I do procedures called coronary angiogram, looking at any block in the arteries to the heart. If there is a block, I'll be putting a wire, a balloon, stent, and open that artery, and that procedure is called coronary angioplasty, meaning angio meaning arteries, plasty meaning repair. So the angioplasty is repairing the arteries. So I can do that by a microsurgery. Similarly, we can do, using the same micro techniques, we can do a lot of correcting the problems inside the heart. But there are times when we won't be able to do that by microsurgery. And in that situation, we refer the patient, I refer a patient for an open heart surgery. An open heart surgery is where a surgeon who is different from an interventional cardiologist, a surgeon will cut through the center of the chest, open the chest, take the heart and deal with it, whatever the problem is. If it is blocked arteries, they will do a bypass surgery. If it is a problem with a valve, they will open the heart and remove the valve and put a new valve in. So these kind of surgeries are major invasive procedures. The surgeries are getting more refined these days, and people are trying to do it with, they can do it in a micro-access, minimally invasive surgeries, but most of the surgeries are still done by a major open surgery. Once a major open surgery is done, the problem that you went with or you came to me with initially will be addressed by the surgeon. But the recovery phase is usually fairly prolonged. If you have a micro procedure, you can go home 2 days later or the next day even, and you'll be back at your work on the Monday morning. So that is a very common thing. I saw a patient yesterday morning having a heart attack. He's perfectly fine today. I'm discharging tomorrow and he'll be back at work on Friday. But the same is not true after a major open heart surgery. So if you have had a major open heart surgery, you will be discharged usually around day 5 to day 7 and you'll be going back home. But the recovery period is very, very important. And during that recovery period, it is very important to understand what to do and what not to do. Most surgical centers do a very good surgical work in India. And when I came back from the UK, I was actually very impressed by the quality of work that is being done in India, which is as good as I saw in the UK. But what I did notice was that following the surgery, after the surgery was done, the care that the individual patient was getting was left to what they would have at home, with very little understanding of what to do, what not to do, and a lot of patients weren't aware or weren't even sure as to what they can and cannot do. In the UK, there is a program called cardiac rehabilitation following cardiac surgery. Every patient after heart surgery will be referred to this cardiac rehabilitation program, and in the northwest of England, I was leading this cardiac rehabilitation program because I have a lot of interest in preventive cardiology. So I was working in that area. In that time, what we did was, for a whole month after surgery, these patients were attending as outpatient to the cardiac rehab clinic, where we would give them advice on what to do, what not to do, plus most importantly, lifestyle modification, and also graded exercises, education on what to eat, what not to eat, and how to manage stress. And these specific interventions improved the outcome, and at the end of a month, patients felt far better with the cardiac rehab than those who didn't come for the rehab. So I am planning to try and bring that into the Indian system, where patients who have had a heart surgery can have a focused cardiac rehabilitation for a week. And in that context, I have teamed up with Shathayu Ayurveda group, who are a very eminent group of Ayurvedic physicians and headed by their chief, Dr. Swami. And the two of us have organized a integrated care approach to cardiac rehabilitation after heart surgery. So what we do, if you have had a heart surgery wherever in the country or outside the country, wherever in the world, if you have had a heart surgery, following heart surgery, if you contact us, then we will offer you a week-long stay in our retreat in Devanahalli, which is a 5-star accommodation with a fantastic existing treatment center for Ayurveda. And in that center, we will see you together, myself and Dr. Swami. We will meet you, we will see you together. We will go through your surgical records. We will then give you a tailored plan for a whole week, which will include graded exercises, dietary intervention, regular advice and also supervision by a very senior physiotherapist, focused treatment from the Ayurvedic side, as well as yoga and meditation. So this whole package of intensive focused rehabilitation program over a 1-week period, plus education on how you can carry this forward once you get home, will help you get back to completely normal health within a period of month after a heart surgery, major heart surgery. Most of my patients, when I refer them for heart surgery, they're very reluctant to go ahead with it because they are scared that the heart surgery will make them very weak and affect them in their future and all that stuff. That is not at all true. If you have had a good surgeon operating on you and have heart surgery, following the heart surgery, if you happen to have good cardiac rehabilitation, you will be really back to normal. In fact, you'll be back having more energy than before, because previously you didn't know that you had a serious heart problem. Now the surgery has fixed that problem, and the rehab has helped you get back in style, get back in fitness, and get back to your normal lifestyle. So that is so very important, and therefore we are coming up with this 1-week-long residential rehabilitation program, which combines modern medicine and traditional Ayurvedic therapy in a form of an integrated care. And this is delivered in our Devanahalli retreat. And if you're interested in knowing more about it, please call the number that you will see in the TV now, and we will be able to take you through the process of how to register and come and stay in our retreat, and we'll be delighted to help you in your recovery process. Thank you.